Set. All right. Well, good evening, everyone. We thank you again for joining us. This is the Simsbury Spirit Committee, Simsbury Problem Identification and Resolution of Issues Together. And so this is part of the subcommittee, the event subcommittee, and we have been doing, as I've just been told, this is our 15th Let's Talk discussion. And so we definitely try to have discussions on relevant topics, that allows for exploration, that allows for, education as well, just to help the community, just to deal with issues that we might not normally talk about so much. And so this is what we've been doing to try to work on diversity in the Simsbury and the greater Hartford region. And so we tonight's topic, we're dealing with mental health. And so we've done a variety of topics, as you know, at number 15, dealing from, racism to anti-racist. We've done HIV and AIDS. We've done Asian American and Pacific Islander hate issues. We've done Muslim American, Arab American, and man, this has been a lot of topics. I'm missing quite a few. Hispanic heritage, but it comes just a great opportunity again to learn, because we always just dealing with topics, hopefully that just aren't, they're topics of relevance, but we're just not always having conversations about them. And tonight's topic is one that is very, very relevant. And we're not, again, having that discussion that is necessary. And tonight's issue is about mental health and how that's been impacted by COVID. And again, one of the things that make our discussions relevant are the panelists that we have. And so we thank, the experts that we have once again that are here to share their expertise, to share their knowledge, to entertain our questions, and just to allow for an atmosphere of, of knowledge first and foremost, and expertise and wisdom. And it allows us all to be a little bit better, than how we came into this conversation. And so our guest panelists tonight, we have Dr. Melissa Santos, and she's part of the division chief of pediatric psychology at the Connecticut Children's Medical Center. So Dr. Santos, just put your hand up for us. Thank you. We also have Jennifer Curtanis, and she's the director of the Farmington Valley Health District as well. And so Jennifer, we thank you for joining us. You can put your hand up as well. And with my sons in school in Simsbury, we quite see the name for the Farmington Valley Health District quite a bit, with what's happening with the schools and the students and such. So it is refreshing now, at least to be able to put a face, with the name that I see just about every day, as a matter of fact. So we also have with us Mark Layman, and he's a licensed family therapist, and he's the owner of You Are Heard. And so maybe we'll hear a little bit more, about his company that he has as well. Mark, if you put your hand up, thank you, appreciate it. Thank you for joining us. And last but not least, we have Dr. Nicole Hill, who's a psychotherapist and does counseling and psychological services at the university. She teaches at the University of, at University of Hartford, thank you, and has received a degree from the University of Connecticut. But thank you, Dr. Hill, for joining us as well. Yes, it is. There's the big H in case I missed it. Thank you. But so this is our expert, our ex-panelists of experts that are here just to again lend their expertise. And these are it's just a topic that we're dealing with. We can be so overwhelmed by what's happening with ourselves, with our families, workplace issues, societal issues, medical issues. There is so much that is happening. And I guess it's one thing, a testament to the resilience of people, but I think it's also to the point that we don't get to express exactly how we're feeling, when we have these variety of issues that are happening. So we are so grateful that you've all taken the time out to join us this evening. And so again, we say thank you to the panelists. We say thank you to the Simsbury Public Library for giving us the technological assistance and the forum to be able to have these discussions. And so we're just grateful, for the audience for taking your time out as well. So that being said, we're gonna get into it, and we're just gonna allow the panelists. First and foremost, we're gonna start with Dr. Santos, and just to give a little introduction about who she is and what it is that she does. So thank you, Dr. Santos. The floor is yours.
So hi, everybody. So I'm Melissa Santos. I'm the Division Chief for Psychology at Connecticut Children's. I also run the hospital's obesity and adolescent bariatric surgery program. So I work with kids across our hospital that are coming in for a range of both mental health and medical conditions. So the kids that oftentimes we see have that combination of those two features. Obviously, we've seen a big uptick since the start of the pandemic, which I'm sure we'll get into discussing more. But thank you for having me.
All right, thank you, Dr. Santos. Next we have is Jennifer Curtanis as well, and she's again the Director of Health at the Farmington Valley Health District.
So thank you very much. It's a pleasure to be here. As mentioned, I am the local health director representing the Farmington Valley Health District, which serves 10 towns, including the town of Simsbury. I've been serving in that role for 10 years. Probably most people didn't know what the local health department was before this pandemic, sadly, but we're all about disease prevention. And most people probably knew us from our regulatory functions, providing environmental services, safety of food at restaurants, approving septics, that sort of thing. But less known work that we do is really around disease prevention, whether that be infectious diseases or chronic disease prevention. And prior to the pandemic, we really were immersed in some mental health initiatives, primarily with veterans, recognizing that there is an inextricable link between mental health and physical health. And in our country, in our public health systems, we have often separated those two, but we really cannot separate the two. And so during the pandemic, your local health department, as Nkosi mentioned, we are working hand in hand with our school systems. We do contact tracing. We are providing vaccination services. And doing the best that we can to try and slow or prevent the spread of this new virus. So that's what we've been up to lately. Thank you.
All right. Thank you, Jen. Again, thank you for joining us. Next, we have again Mark Layman, who's a licensed family therapist. So, Mark, please introduce yourself as well.
Certainly. Thank you for having me. I appreciate it. So as Nkosi mentioned, I'm a family therapist here in Avon, and I have a private practice where I see young adults predominantly in middle school, high school, and college. I do run a second business called You Are Heard, which is a virtual private practice where we counsel and coach students all over the country.
All right, nice. And the virtual component, so I guess that's directed for the times that we're in, I'm assuming, as well. So that's a nice adjustment. All right, and last again, but not least, we have Dr. Nicole Hill, who is the psychotherapist and counseling and psychological services with the University of Hartford. Introduce yourself for us, Dr. Hill.
Sure, yeah, thanks, Nkosi. So yes, I'm Dr. Hill. I am one of the counselors in the Counseling Center at the University of Hartford. So I work primarily with undergraduate and graduate students at the college. I also have a very small private practice that's entirely telehealth right now, thanks to the pandemic here in Simsbury. And so it's really great opportunity, I think, for all of us to have the time to kind of reflect as practitioners and clinicians about like how this is affecting us in all of our different settings, and in particular, kind of as residents of the area, just how it's affecting us too. So I really appreciate the opportunity.
All right. Okay. Well, thank you all again for joining us. Thanks for your introduction. And we're going to get, just go straight. Each panelist has been given, some time to speak. If anyone in the audience, if anytime you have a question, If I can see you raising your hand, that is fine. You can do that. I know Nicole has her eyes on things, and we also have the chat feature as well. So if you have a question, you can always put it in chat as well, and that's also visible. So at any time, if you have a question, anytime, just feel free, to raise your hand. Feel free to put your question on chat if needed. So we definitely are looking forward to some of the questions from the audience as well. All right, so first we're gonna go with Dr. Santos. So Dr. Santos, again, if just kind of actually we have some of the some questions, and then we'll just go from there. So Dr. Santos, our first question for you is just asking, what is it that you are seeing, in particular at the Connecticut Children's Center at Medical CCMC right now?
So since the start of the pandemic, we have seen a big uptick in kids coming in with a variety of mental health concerns. And particularly initially when COVID first started, what we really saw was an influx of girls coming in with a range of eating disorders. And we really started to see that restrictive eating early on. And it was pretty interesting because all the stories were sort of the same. Life changed so dramatically for all of us, but for our kids, they were going to school one day and the next day it was like life completely changed, the schedule is upheaved. And it's so interesting because we'll say to our kids oftentimes, like, if I told you that you could do school from home for the rest of the school year, you never had to go back in, I think kids would have been like, yes, where do I sign up for that? And after like 2 days of telehealth learning, they were like, no, this is not what I want at all. But our girls were sort of reporting the same thing. Life changed. They had no control over anything that was happening. They had no routine. What they knew to be their life was completely different. They couldn't control anything. And what they could control was their eating and their exercise. And it went from eating less, restricting more, exercising more to get rid of stress. And then it quickly spiraled. And it was very fascinating that was really what we saw at the beginning parts of the pandemic. And since then, it's been a pretty significant stream. Every area of our children's hospital where we render mental health services, our outpatient clinics, our specialty care clinics, the emergency room, the medical floors are just overfilled with kids at this point, and presenting with really everything from concerns for eating disorders, being hospitalized because they're no longer able to manage their medical conditions. So they're ending up on the floors because their management of their type 1 diabetes, they just can't do anymore because of their depression or anxiety. Kids coming in because they were home, they found pills in the cabinets and they were really sad. So they were taking attempts on their lives. So we've really seen a huge variety just upticking since the start of the pandemic across the board.
So I guess my initial thought, to that is, how come we're not hearing very much about, this part of, of the reaction to COVID with children? How come this is, if we're not talking to you, this is not what we're not going to hear these things?
Yeah, I think there's been a lot of emphasis placed on volume issues, that there's so many kids that have mental health concerns. They're sitting in our emergency department, the impact of the lack of school. I think that the issue that we're experiencing when it comes to children and mental health is not new to the pandemic. Children's mental health services was completely underfunded before the pandemic. There was never enough services before the pandemic. We had kids sitting in our emergency room before the pandemic. This is not anything new. What is new is the complete clogging of the mental health system that we have here in the state of Connecticut. Dr. Hill, you mentioned you have a private practice. I'm sure you're not bored and you could probably see a lot more patients. Mark, the same thing. There is no place for families to turn that needs services unless you know somebody who knows someone who can kind of like slide you in. And so we end up with kids in our emergency department that can't go anywhere else because there is nowhere else, because kids that are in the inpatient hospitals are waiting for someone who's in a step down program to get out of that step down program, but they can't leave that program because there's no community providers that have openings. And it's just across the board, not enough resources, more families accessing it. And it's just a complete clog of the healthcare system. And sadly, this isn't going to get better. Just if COVID, aside from this new variant that we have, if COVID ended today, we know from our psychological research on other pandemics that weren't as big as COVID, kids that experienced 9/11, adults that experienced 9/11, research from Hurricane Sandy, from Sandy Hook, from other sorts of things, we're going to see this mental health impact of COVID for the next 5, 10, 15 years.
Wow.
We have such an opportunity right now. And if we can't fix this now, we are in for a really tough road moving forward. I'm sorry, I feel like I went off on a completely
No, it's
somewhere completely else.
it's good. So that's fine. And then I'll just say, Dr. Hill, perhaps if maybe you can follow up that, because you are on the college campus. And so maybe, you know, that's something you can show how COVID is impacting, you know, the adults and young adults that you see on a college campus.
Yeah, absolutely. I think that, you know, one thing that's been really, I guess, positive, you know, when there's been so much negative with the pandemic, but I think one thing that we've seen at UHeart, and I'm hearing this from my colleagues at other colleges in Connecticut and out of state, is that because of the switch to telehealth and because of the fact that this was such a universal experience, people felt more comfortable saying, like, I'm affected by this and I need some help with this. So we've noticed a decrease in the stigmatization of seeking therapy. And in fact, so many more of our students came back to us, you know, last spring when we came back to campus, this fall coming back to campus fully in person, saying, oh yeah, I've been seeing a therapist for the first time, or my family went into therapy for the first time. And so there was kind of this excuse that brought everyone together, that people felt more comfortable doing that. So I think that it's been really great to see that. I mean, we've been fighting for years to try to destigmatize mental illness and seeking mental health. But like Dr. Santos is saying, like, we've just seen a massive increase in demand, you know, because now it feels better to do that. People have had a positive experience. Now they're coming back to campus and wanting to continue that experience, or students who maybe didn't have access to those resources at home. Now that it's free on campus and they don't have to use their insurance and their parents don't have to know about it, all of a sudden, it's much more desirable to them. But our counseling center hasn't gotten any bigger. And so, you know, the demand is really kind of, and like the utilization of services, we've even seen students, we used to see a lot more students would make appointments and not keep them, or they would be a little bit more comfortable rescheduling or no showing. We haven't really seen that attrition either. So I'm wondering if Mark is seeing that, if Melissa is seeing that too, just the sense of like, when someone makes an appointment, they're keeping it and they're wanting to stay. And so some students that we might only see a couple of times, or students that might kind of flake out, we're not seeing that. Yeah. So, you know, we're coming into, this is our last week of classes at UHeart, final start next week. And our department is really strapped to try to find places in their home states or in the state of Connecticut where we can, you know, transition their care. So they're not without care if they really need it for this, you know, 6 or 8 week winter break. So, I mean, it's great that people feel more comfortable talking about mental health and illness and getting treatment. But if there's not the resource there, you know, it's really hard for us to say no. And parents and faculty and staff and administration at UHeart are like, you know, you need to do more. This is a mental health crisis, the pandemic. And we're like, yes, yeah, we understand. And there's only so many students I can see a day. And I know we're going to talk more about this as a panel too, but it's sort of like, you know, we are talking a lot about the impact on children, young adults, and everyone. But, you know, talking about how it's affecting providers. Obviously, medical providers have experienced so much trauma and hardship, and we're seeing burnout and people leaving their jobs there. But I think it's mental health providers too. We are all toast before we started in the fall, you know, and so I think it's been a really unique challenge, you know, to try to embrace the fact that more people than ever want care. And of course, we want to do that. That's why we went into this field and this profession. But, you know, finding ways to do that without burning ourselves out and not being able to take care of ourselves while we are being so intensely affected by the pandemic and all of the ways that we are too, has been, you know, something that we've just never really seen kind of in a college setting as well.
Wow, that's a lot. And but just to follow, because I really like what you said about the part of the decrease in stigmatization due to COVID. And so I guess I wrote down, has that created like an increase in empathy, or people, is that something that you can see that people can say, I understand you a little bit more, or is there maybe an increase in community a little bit, what's happening with that decrease in stigmatization? And then we're going to keep moving, but I just wanted to ask that.
Yeah, no, I think that's such an important question, because again, it's really this, more than ever, students and everybody really feels like they can understand at least some elements. So maybe not all of us have lost someone close to us, to COVID, or maybe we don't know anyone who's actually had COVID, but everyone can relate. This has really kind of created this joint sort of experience of community and of struggle, that I think has made it okay to talk about, in the same way that, adjusting to college has always been like, okay, like that's something that we talk about. That's a pretty common thing students come in with, especially their freshman fall semester. This is interestingly, I think, something that is just going to become something else that college students for the next 10, 15, 20 years will say, like, we all had this experience. And it affects the way that we adjust to college. It affects our college experience. It affects our transition into adulthood. And so I think, yes, I mean, I think there's that sense of unification. Like, I can understand, even if I didn't exactly have your experience. And so that opens the conversation. But, it's being able to accommodate the conversations.
Okay, wow. Sounds like I need a lot of maybe group talking, group therapy, and things like that. Try to accommodate the numbers as best as can be done. Okay, but thank you again, Mark. And so just asking you, what has COVID? How has it impacted, the mental health? Have you seen with your work with teens and college students and young adults? What are some of the things that you're seeing?
Sure. So to clarify, my virtual practice, I started 10 years ago, and
you're ahead of the game.
I was ahead of the game. And when COVID hit, Nkosi, I got a few phone calls from colleagues to ask them, how do I do this? Because everybody went online. And so I agree with what Nicole was mentioning. I've seen I think the silver lining in all this, I've seen a really nice openness happen with college students around not just mental health, but I would say like kids that don't have diagnoses that I call like subacute. So they've got symptoms of anxiety or symptoms of depression. They've never had a full-on diagnosis. They're able to talk about it, and they talk about it with each other. It's not, sort of the difficult topic that it used to be, I think, amongst college students, which is fantastic. Certainly the downside is, and you're referencing this, Nicole, is there's not enough therapists out there comparative to the amount of kids. And I would say that was the case going into COVID, Nkosi. It's certainly gone up since COVID. So now we're dealing with those subacute kids as well as the kids, that are high level of care that Melissa sees at Children's. And unfortunately, out in the community, most therapists are super, super busy. And so, if I'm having trouble finding, a therapist for a friend of mine or, a relative, then certainly the general public is as well. So we've definitely seen a change that way. I would say, if I had to kind of focus a little bit as to, the why around all of this, I think a lot of it comes down to the unpredictableness of where we're at. I mean, if we all were talking about, hey, what's next year going to look like? None of us really know, and last year, the dreaded, what was it, March 13th, when everybody packed up and went home. I think none of us really knew that was going to happen for as long as it did. And as Melissa and Nicole and Jennifer referenced, I think there's a ripple effect that happens for everybody, kids and adults, when, life just, comes to a screeching halt. So I would say as a provider, both in my office and virtually, we're seeing a lot of that now, where kids are either behind academically, they're behind socially. Some kids, literally spent the entire year last year at home. And so the integration, reintegration, Nicole, I've seen it on, 20 or 25 campuses where kids were home all year. and now they're back on campus. And so socially, they're behind, and academically, I think it's become real challenging. So as a result of those things, we're seeing more and more symptoms, and those kids are seeking out ways to get assistance.
I like that. And so, and just to follow up with that part of what you mentioned about things being unpredictable, you know, we don't know what it's going to look like next year, next month. You know, I don't always think about things in those terms, but it is very true. And so do you see like there's a reaction from kids due to the unpredictableness? Like I'm thinking, is there more of like a carpe diem, you know, mentality, seize the day, or kids?
That's a good question.
Are they a little more, you know, laid back and patient because they don't know? Is there any, do you see a shift? Like
yeah, that's a great question. I would say, I guess it's going to be a bit of a negative answer, but I would say I see more kids worrying and are anxious. And I relate it to like in elementary school when teachers put the schedule on the board for the kids so they sort of know what's coming. These kids don't know what's coming. And so, you know, when that's the case, we're now in the phase with seniors in high school. My son is a freshman this year in college, and we brought him to school in September, and we literally didn't see the school until we brought him. He got an opportunity to travel down there one time, but these kids are being affected that way too. And that the normalcy of let's go visit the college, let's choose a college, you know, I mean, last year at UConn, I believe the only kids that were offered housing were freshmen. And so, you know, you had a lot of displaced kids. And so I think there's some worry associated, Nkosi, with that I literally had kids say to me, I'm worried this new variant is going to create that same issue. And so it just kind of looms over these kids as to, you know, are we moving in the right direction or the wrong direction?
And I think the other important part to remember is that children's mental health doesn't occur in a vacuum. It also occurs in the environment of their family life. And, you know, we've always said, and it's not meant to be a joke, but like, is anybody doing well with their mental health? Parents, grandparents, aunts, uncles, any of you all on this Zoom, like we're all struggling. And so it's not like our parents have the full resources or grandparents have the full like resources to be able to take because they're stressed. They don't know what's going to happen. They don't know about their jobs. They don't know if they've been sick or things like that. And particularly for some of our parents that are frontline workers or in jobs where they have a high risk for infection, that's been a lot for them to carry then home to their child. And so that's going to create an environment in their house that their child's going to also be impacted by as well.
Absolutely.
Yeah, I would say too, like to both of your points, like I wish, and I guess in some ways, like we've been a bit surprised. We kind of were hoping to see students come in with a little bit more grit and a little bit more resilience. And really, we haven't. In fact, you know, we've really seen, particularly the freshman and sophomore classes, like they really just don't have the skills and they don't have the support. And so instead of kind of really feeling like you're saying in Cozy, like this is an opportunity for us to kind of like rally and to kind of, you know, be made stronger by this hardship. We're not seeing that. And I think like to Mark's point, that's why we're seeing students who have never really struggled in any kind of capacity psychologically before coming in and sort of being like, I don't know what I'm feeling. Something is wrong. Something is off. Something is missing. I don't know what to do about it. And no one around me seems to know how to do it any better. And so I think we're seeing this effect, you know, more phone calls from parents, more phone calls from coaches, more phone calls from staff. Of like, what do we do? And like, there's not always a fix for something like this. And, you know, with everyone in that person's environment being affected too, it's not just like the identified patient or the identified problem is the kids. It's really all of us are trying to figure it out. And there's no sense of like, is this going to get better? And what can we do? So I think we're a bit baffled, and really that's what our winter break is going to be a lot about, is what do we do? You know, how do we offer something for these students to help them rally a little bit instead of being really paralyzed by the difficulty?
Yes, uncharted territory here. And Jen, how does this impacting you, you know, with the Farmington Valley, you know, health district? You see, it's all, you know, the mental health, you know, component. And so I know you're saying you deal more with the the disease, the virus itself, and prevention. So is that something that you're branching out into as well with the mental health and all this, or?
So, right, I mean, prior to the pandemic, we were doing a lot in the mental health sphere. We had a school-based initiative called Resilience Grows Here, which really was focused on building those resilient attributes of our youth to deal with adversity. For obvious reasons, mostly staff and bandwidth and kids having to shift gears in school, that program's put on hold. We had a veteran-based initiative, a peer mentoring program to really connect veterans around mental health issues. That suffered dramatically because of, we were trying to break down the isolation that veterans often feel, and some of that was impacted by the pandemic. So mental health is an issue that the health department is very concerned about. During the pandemic, we're seeing the implications of this across the spectrum. So, for instance, early in the pandemic, we were working with all of our long-term care facilities. So all those frontline workers who on a daily basis were seeing the people that they cared for day in and day out disproportionately represented in the death statistics. And at that point in time, there was nothing they could do. There was a shortage of PPE, and they just felt so helpless in this. And that created a lot of disconnect or mental health struggles for them. Now, when we do contact tracing, we talk to individuals that have COVID. We talk to family members who have COVID and people that are hospitalized. We talk to people who have just lost a loved one to COVID. And so we're seeing it across the family spectrum, the impact of this disease. And then, of course, the school-related issues. I mean, it brings neither me nor my staff any joy in having to quarantine kids or keep them out of school. And I'd just like to comment that we've worked exceedingly closely with all of our school districts to minimize the impact of quarantine. As we started to learn more about this disease, how can we be more purposeful and keep more kids in school for longer? And I think in the Farmington Valley, we've actually done a really good job with that. We still need to do more, but the stresses that we see from moms who have work full time and need to juggle childcare, or in the early days, families doing both working out of home and setting up a learning space for their kids. Their home was no longer a place where they could escape from some of these things, right? Because the computers were set up everywhere. So, we've seen the impact on mental health across the board, from our caregivers to individuals and families that have dealt with COVID. And I do think in some respects, because this has touched every one of us, whether it's the fear, isolation, uncertainty, disruption of normal activities, loss of a loved one, it runs the gamut. I do hope that one of the positive things is that people who need to talk about, their struggles will feel less stigmatized to do that. And it sounds like that is playing out. But I'm also very concerned about lack of resources. There was a deficit, as Melissa mentioned, even before COVID. These mental health issues are going to last long after COVID. And we have a long way to go to make sure that we have the services and resources available for everyone and anyone that might need them.
I think that's a good segue, to actually a question that we have from the audience with your that last comment you just made about the shortage. And so this is from Rick Brush, and he asked, from a systems perspective, what has caused the shortage of providers that is now even more strained given the increased need for services? So that's what he was asking from a a systems perspective. So anyone could take the floor to answer that.
I'll jump in for a minute. I think it's important for people to realize that we were short before the pandemic, and so when you look at statistics, for example, even on college campuses, I mean, the ratio of providers to students is just not what you want it to be. I feel like every college I speak to is doing amazing job with the students that they work with, but there's only so many of them. And so I think that's what we see in the community. It's probably, I'm imagining, Melissa, you guys see that even down in the ED at Children's. So I just think some of it is a numbers thing in that, we've seen more burnout across the board, I think, with therapists and providers, and we don't need less, we need more providers. So, to those students that are listening, go into the psychology field. It's a good field to go into because we need more helpers, that's for sure.
All right, thank you.
I would just like to comment. I hear from a lot of people that are seeking mental health services that a lot of them are private pay. And so it's very challenging for many populations to pay out of pocket for those services. And that's not a criticism of the providers. I think it speaks to our healthcare system in general.
And I think that's a good point, because the reason why so many people go to private pay is that a lot of organizations that hire mental health workers don't hire a large number because the reimbursement is so poor for our services. And we never like to think about the business part of mental health, but there is a business part to it. And there is a limit to how much organizations can hire behavioral health workers if our insurance payments for our services that are so needed are so low. There's just no way for a company or a business or an organization to ever make the case to hire the amount that's needed when you're getting paid so low.
Yeah. Say it how it is. It's okay, Doc. Say it how it is. All right. And so, and then we have another question, but Jennifer, if I could just follow up with you quickly, and then we have another question from the audience. And you mentioned about kids being able to trying to get kids to stay in school, longer and all this. I guess my immediate thought was, is that tied to vaccination? Is that something as vaccinations levels increase the population, and that allows some more degree of normalcy? Is that the correlation?
Yeah, I mean, we're already seeing this play out in the middle school and the high school grades, where the Farmington Valley's done fairly well with vaccination rates, definitely for adults, and we're seeing that continue to increase for kids. But in the middle and high school ages, we're averaging less than 4 kids quarantined per case, in large part because the vast majority of the kids are fully vaccinated and as a result can remain in school. So we've just started, we'll continue our second dose clinics for the 5 and up group. At the end of next week, we will have vaccinated just over 1,000 kids in that age group in the Farmington Valley. Of course, we have 8,000 kids in that age group, so we hope that more individuals will take advantage, but that is a key component to keeping kids in school. If they're fully vaccinated, they don't have to quarantine if they're a close contact.
Okay, all right, thank you. All right, and then so we have a question here from the one of our audience members. It's from Cheryl. And she says, my recent college graduate has gone from an atypical college experience to a hybrid work setting and the isolation of being in a new city with a new job and working alone in his apartment. It is really sad to see how discouraged he is, even though on paper, everything should be fine. Where do these recent grads go for help?
That's a great question. I mean, I see it as well with students that I work with. Most of them start off in college and then eventually graduate and get jobs. And I think that's an all too common story that I've heard, the isolation piece. And, I think I would say that the typical place one would go to get assistance might be a therapy office. but I would not overlook, sort of other opportunities that may be less strictly therapeutic, whether it be joining clubs or activities, gyms, whatever it might be out in the community that, you'd be around people. And I would say that in the past, those young adults didn't necessarily have to rely on that because they had their colleagues at work and they had their friends when they came back. But more and more, I'm seeing kids in New York City sitting in an apartment, with their roommate, and they're both in their rooms at work online. And so there's just a lot of isolation with regards to that. So, be looking for, sort of those out of the box opportunities just to be around people would be my suggestion.
Yeah. And I just like to add to that. It is a great question. I have kids of that age as well. One, maybe talking to the employer, it's going to be interesting to see post-COVID how many work environments maybe remain remote or partially remote, and what the longer term impact of that would be. But most large employers have employee assistance programs that could be a free resource available to an employee. But also, we have to be more creative, but there are absolutely safer ways in which people can come together socially. We might have to search for those things, as Mark suggested. It might not be as easy as just connecting with colleagues or coworkers, but there are reasons. Everyone has a different perception of risk and level of risk they're willing to take. But within that, there are things that people can do to get together and be social.
Okay. And, I like watching sports, and I just, I hear what you're saying about gathering together. And, I watched a lot of college football games or NFL games, and I'm not comfortable. I don't know if it's because of where we are. Is this a regional thing? When I'm seeing like these arenas with 90,000 people in it and not a single person is wearing a mask, I'm just, when you say about how we can get together like comfortably and responsibly, is this like a regional thing we're looking at right now, or how I don't know. Am I the only one who feels a little uncomfortable seeing that?
Well, go ahead, Jennifer. Yeah.
Well, we do know that different parts of the country are experiencing different vaccination uptake and different perspectives on what COVID is and that sort of thing. So yes, there is a regional component. I do think in the Northeast, typically people have been more conservative. We've had a greater uptick in vaccination rates and that sort of thing. But right now, we still have very high community transmission levels. We're back to levels as high as we had last spring. We don't know what Omicron is going to present. We do know that vaccination rates are high. We know that, fewer people that are vaccinated are far less likely to get it and spread it, to be hospitalized, to get really sick. But I do think everyone experiences or has a different perception of risk. We are giving people all the tools we can: vaccines, masks, social distancing, other strategies. And then ultimately people have to make their own decision about what they're comfortable with.
Yeah. Yeah, Nkosi, if I could just jump in with two, I've had the thought, I wonder what'll happen if some of the young adults that have sort of gotten used to not wearing masks and kind of, not having those rules have to go back to, those ground rules. Because a lot of the colleges have loosened up. I'm not sure what UHeart's like, Nicole, but a lot of them have loosened up on their restrictions. As I said before, we don't really know what the next few months are going to look like. So it'd be interesting to see if the rules sort of change again. How do young adults react to that?
I think to that point too, Mark, I mean, that's been such a point of contention for a lot of my students over the last year and a half. Is like, oh, my sister is down at, North Carolina, or my friend is down in Texas, and like, they don't have to do anything. They don't
That's
have to be vaccinated. They don't have to wear masks. There's no restrictions. They can have visitors. They're having football games. Like, I think that's been something else that has created kind of this like angst and like this resentment, especially towards the college.
Yeah.
And I think this is true for all colleges across Connecticut because, you know, regionally, Connecticut has been much stricter with what they've been expecting of college students and employers and everybody. And so I think a lot of UHART students are really pissed because they're like, why can't my parents can't even come for October weekend, or I can't have my boyfriend can't come visit me from New York. And, you know, but I think, you know, so like that's going to be interesting. And I think that creates its own challenges with students deciding whether they're going to follow the rules of their institution or their workplace or their town or not, and what the consequences might be of that. And unfortunately, when we talk about a pandemic, the consequences can be really dangerous, unfortunately. And these are young adults whose brains are not fully formed yet. And, you know, I think like it can be a really dangerous like situation. But so, I mean, I think we can talk some more about that. But to Cheryl's question again, too, I mean, I think something else that's important, and this is a message that as a counseling center, we've really been trying to instill in faculty, staff, parents, peers even, is that you don't have to be a mental health professional to have some of these conversations that can be supportive and therapeutic and helpful. And obviously we don't want students who are really kind of clinical, very kind of acute, very impaired, not getting care that they need. But so many of our students really like would benefit from just reaching out to their roommate or to the RA on their floor or to some, you know, to other places. Like Mark was saying, you know, is there a priest or a pastor or a rabbi on campus or in your community that you could have a conversation with? Are there other professors or coaches or other departments on campus that you feel connected to? Are there upperclassmen that you know? Do you have older siblings? Do you have, you know, so I think sometimes like we all have to think a little bit outside the box, and it's easy to focus. And again, particularly for children and young adults, to really to ruminate and fixate on like what's missing or what's wrong or what they can't do, and feeling like they're being punished or that's being imposed on them. But a lot of this is like, what can you control? What are some of the things that you can do? You know, it might have to be creative. It might have to be in a different format. It might have to be in a smaller group, or you might have to be masked when you do it. But to really not be completely shut down, you know, it's like you let's brainstorm. What are some of the things you can do to stay connected and to feel like you're part of the community or you're part of your new workplace? So I think it's, you know, everyone is having to think outside the box and try things that maybe they hadn't before.
Can I just add to that? Something that Nicole said, you know, everybody's familiar with CPR, which is layman's training for dealing with a heart attack. There's also mental health first aid, and there's also suicide prevention training for lay people. And that's something else that we all could think about. This is absolutely not any type of a substitute for professionals, but it helps all of us know how to engage the question, how to ask our friends or family members, you know, how are you doing? And maybe assess when they need to really tap into clinical resources. So mental health first aid and suicide prevention trainings, two things that, you know, all of us as community members could take advantage of to just become more well-versed in mental health in general.
Where do we access that? Because we'll share that after this.
Well, we were providing mental health first aid and QPR training before the pandemic. We have just started to do some mental health first aid again for first responders in the area. So we can circle back to see what that might look like, you know, either through the Spirit Council or the library.
I do know that the Wheeler Clinic offer, or at least used to offer free training. We've had them come to UHART before for kind of staff as well. And so I think it's an excellent point, is, you know, more than ever, there are resources that have been there a long time, but I think more parents and people, concerned community members that want to be there to help, whether it's really life-threatening or it's just more of how do you have conversation with someone who's struggling that day. It's the more and more that everyone in our community feels comfortable having those conversations, and the more that our young people feel like there are people in their world they can talk to without necessarily having to find a doctor or a therapist who can have that conversation, it lightens the load for everybody.
Yep. Yep.
Is that something too that would be appropriate for even like a college student, maybe even a high school student to do, to feel empowered to care for each other and be, because I think what you're saying is when they feel frozen and they feel helpless and out of control, that's when the spiral happens. Whereas if there are things they can do to be helpful, even sometimes the best antidote to something sinking in you is to go help somebody else, So is that something that would be appropriate for that age, or is it too much?
No, I think it absolutely is. And Nicole, you could speak to this, I'm sure as well, that on a lot of college campuses, there are offerings like that, whether it be peer-to-peer counseling. I mean, really, in many ways, guys, what we're talking about is effectively listening, and just being a good listener. And, also knowing if you're a young adult, knowing when something is kind of above your pay grade. But so much of this isn't. So much of this is something that young adults are surrounded by. It's rare that I meet a young adult and I say to them, do you know friends or people around you that are depressed or that are anxious? It's rare that I hear someone say, no, don't know anybody. So they're surrounded by it. And I think the more training they're able to have, even like easy offerings that schools do offer, whether it be to orientation leaders or RAs or just generally students, I would absolutely suggest.
And I think that's the key point, is that our teens and our college students are being exposed to these conversations all the time. And where these trainings can be really helpful is empowering them to know what to do so they don't feel like they just have to sit with them.
Absolutely.
Cozy, Robin has had her hand up for a while.
I was about to say, yep, we have an audience member, Robin Batchelder, to have a question. Go ahead, Robin, floor is yours.
I more or less have a comment. With all due respect, you guys were talking about young adults. I'm 42 years old. I wish I were a young adult, but I'm not. And I have struggled with mental health my entire life, pretty much. My mom is Sarah. I am also on the autistic spectrum. And for me, my entire life on March 13th, like I remember the date like it was yesterday, my entire life stopped in its tracks. And being somebody who, I went to the Riverview School in East Sandwich, Massachusetts, and my schedule, I was scheduled from sun up to sundown every single day in high school. And I think for me, it's like I had won a trip to Australia to represent Connecticut in Special Olympics. That got canceled. I had a nephew who was born 2 weeks before the pandemic started, and I couldn't go and see him. I didn't see my other family members for a year and a half. So I think that, my therapy stopped because I couldn't do telehealth personally. With all due respects to all of you, it does nothing for me. I need that face-to-face listening to somebody. Everybody had to wear a mask. I could no longer process a lot of what people were saying to me because I read lips a lot, and that's how I process being on the spectrum. That's how I process my information. So, I guess I just wanted maybe to speak up and be like, it wasn't just young adults. Like I understand that's what y'all are focusing on, but I'm not a young adult. But I think that what got me through, and hindsight's 2020, but my mother called me every single day, like to the point that I was like, Mom, what do you want? Nothing happened. Like I stayed in my house for 2 months. My agoraphobia, for those of you who don't know what it is, agoraphobia is the paralyzing fear of leaving your house. My agoraphobia got bad. But I just wanted to point out that it's not just young adults that were affected. Obviously, I know that the panel knows that, but nobody said it. But it's people on the spectrum. But my whole entire life literally halted at a point that it was awful. Like I was in a play, my play got canceled. So I just wanted to make the point that it wasn't just young adults, it was also people in their 40s, such as I am.
It's an excellent point. And I would just tie that to, number one, I'm so sorry to hear you went through that. I mean, it certainly has been a rough time for many. But I think your point really illustrates that, not number one, everyone's been kind of, impacted. But number two, many of the young adults that we're working with, they've got parents that have been impacted, and I know, most providers that I know, you're dealing with not only young adults, but also their parents as well. And, I know that that's been a real challenge, in some ways more of a challenge than the students.
Mark, I do have a parent, and that's my mom, and she's the best parent that I could ever ask for.
Awesome. That's so nice to hear. Good for you.
And she rolls her eyes.
Yeah, I would have, I'm glad that you brought it up. We did end up focusing a lot on young adults, but just adults in general, like 1 in 10 adults before the pandemic, reported symptoms of anxiety or depression. And during the pandemic, that's up to 4 out of 10 adults. Other populations that are disproportionately affected are minority populations or populations of color. Families where employment, was, impacted by the pandemic, or families where, putting food on the table or losing a job during the pandemic. Those are populations that were also impacted greatly and continue to be.
You know what, something, I'm just going to quickly say something to you, Robin. I'm a teacher, and the masks are hard because I can't see the part of their faces where they smile, or there's so much that goes on in the lower part of somebody's face. And if you had spoken with a mask on, it wouldn't have been the same thing as what we heard you say and saw you say. And so that's a whole nother dimension to this, that, masks are important, but they block so much.
And I often, and I would tell my mother, like, for those of you who ever watched Home Improvement, Wilson the neighbor, like, that was my life. Like, I only saw things from here up. I didn't see anything else. And it's like, I was living Wilson's life because I couldn't process what anybody was telling me. I couldn't, I was terrified of going to the grocery store. Like, I couldn't. And the anxiety came from not being able to understand or process what people were saying to me.
Yeah. And Robin, thank you, for sharing, your experiences as well, because,
thank you.
And the point of our discussion, sometimes it's difficult to exactly put, a face, or put a real story, a real experience with exactly it is that, we're having this discussion about. So, you sharing that helps, bring, another element of reality, to the discussion as well. So, yeah, so thank you for, for sharing with us this, this evening. Appreciate it. And I hope you're doing well, or as best as you possibly, can be under the, situation. So we definitely are hope you're doing, you're doing okay with things.
I'm doing okay. I mean, I'm actually I think I am the first, Cheryl can vouch for me, but I am the first person ever in Simsbury to serve with autism ever to serve on a committee in town. I hope to go to Australia in March. Special Olympics started then stopped. And I opened my own company. So yeah, so that's actually where I found my niche, was in crafting. And I knew I needed something for my mental health. And so I joined a company called Couture, and I found my niche in my crafting, in which I can do at home and keep myself busy.
All right.
Excellent.
I'm glad you're making it through, one day at a
Thank you,
time,
sir.
right? One day at a time. All right. And I think right before you were talking, Dr. Hill, I wrote down the word partnerships in the midst of all this. And then you went on to talk about maybe if we have like a rabbi or, you know, RA, and I was wondering like, you know, what maybe chaplains or anything, but is this creating like you say, partnerships or a network that many of you are able to work with or access, you know, dealing with mental health because the load is so heavy? So are you guys, you know, reaching out a little bit in all this as well?
Yes, I can say from my perspective, absolutely. You know, and there are pediatricians, for example, that are, you know, having to work in the psych community that, you know, really haven't had a ton of training with it, and they're super collaborative. They want to talk about students and what they're going through and the meds and the side effects, and, you know, and so what's been really nice is that I think people are recognizing if we do link together, we're stronger. We're stronger together. You know, we're able to help, you know, many more families and just be available. So yeah, I would say, Nkosi, I mean, I've always been a collaborator, but I think just in general, collaboration has, from my perspective at least, has gotten wider. And, you know, I always encourage certainly people to contact me if they've got questions, concerns, but I also try to reach out myself, and you know, sometimes people just simply can't, for reasons that we talked about earlier, can't, you know, get to a therapist or can't get to a therapist's office, or like Robin said, you know, teletherapy doesn't work for them. So it's a matter of, right, let's figure out what's gonna work for you. You know what I mean? And if there's a way for me to have that conversation and recommend them, you know, speak to one of our amazing clergy in town, fantastic. That's great. You know, as long as they're getting some assistance.
Okay.
I think we on campus have heard from a lot of different departments and a lot of different personnel that we don't normally. And so in some ways, like, this is, I think, opened their eyes to not only like what we at the counseling center have always kind of known and felt, which is like every member of the community could have an impact and has a responsibility, you know, to try to have these conversations, to, you know, try to kind of be there to hold each other together and to support each other. But that a lot of them are realizing like this is like the opportunity where they feel comfortable reaching out and talking to Dr. Hill or talking to other people on my staff, and not maybe feeling like concerned about that, or like what we might ask them to do. And I think that's been one of the really hopeful things about some of the conversations, is that we get to demystify a little bit about what we do behind closed doors. You know, I mean, not to say that we don't have extensive training and expertise, and, you know, obviously not everyone can do exactly what we do, but I think it's really reassuring and empowering for a lot of people to kind of hear, you know, an academic advisor to hear like, here's just something simple that you could try. You already have this relationship with this person. And so they're going to probably feel more comfortable talking to you about this than coming in to talk to a strange doctor that they don't know like what I'm going to do with that information or what it's going to be like. You know, so I mean, I think yes, it has kind of like opened other people's doors and other people's ideas of like, how do we do some of this? Like, how do I take good care of people around me? But also like, how do I take better care of myself? Because I think that's been another clear message here. And a lot of us as providers can be really guilty of this, is, you know, we can really focus on taking care of who we think we have to take care of. And then what's kind of left for us. So I think for other people in the community to hear, like, it's okay for you to set boundaries. It's okay for you to say no. It's okay for you to try to kind of do what you can within limits. And I think, like Melissa said earlier, like, and then to know when it really is beyond what you can or should do. And when do you bring in someone like us to kind of have that conversation and deal with it. But to hear from people that we wouldn't have ever had conversations with before, and partner with them, I think is like, will make everyone in the community better in the long run.
I like that. And so what does it say? I guess I'm thinking about back to, you know, as the pandemic was occurring. And, you know, one of the essential businesses that was open was always a liquor store, right? And so I guess, but still in the realm though of mental health, where we're talking, you know, I know we're talking perhaps adults or what have you. I don't know if that's much of a switch, but where does that fit into you know, when we're dealing with these issues of mental health, would that cause like some sort of breakdown? You know, I'm asking about that though. Like, how does that fit in with our mental health, that thing?
There are surveys that have been done that have demonstrated there has been an increase in alcohol use and other substance use during the pandemic. And there is speculation that the loosening of restrictions around how you purchase your alcohol, when you purchase your alcohol, that it can be delivered to your door, that you can get open containers of mixed drinks with your takeout food to bring home. All of those things have likely contributed. So it is a real, it is an issue, and it is playing out in the data. That certainly, you know, the stressors of the pandemic have created conditions in which people are more likely to self-medicate. And then the loosening of certain restrictions has just helped facilitate that.
Okay.
Yeah.
All right.
You mentioned essential, I think you mentioned essential workers, and I wanted to just talk a little bit about also, you know, the mental health challenges of our, you know, essential workers who are disproportionately in certain areas like grocery stores, restaurants, represented by people of color. And they, you know, and also are more likely to not have access to sick leave or medical leave, are paid under the table, or don't have access to medical insurance. And all of these factors have contributed significantly both to them being at increased risk for COVID, but also at increased risk of not being able to access the services they need when they are sick, when they need to stay home, even access to vaccine availability. So these are all kind of some of the inequities that we knew existed long before the pandemic, but are being seen in full display during the pandemic as well.
So if you remember, during the early phases of the pandemic, the only way to get a COVID test was if you drove up to a testing facility.
Wow.
If you don't have a car, you couldn't drive up to a testing facility because they didn't take walk-ins. You know, telehealth, you know, we talk about in the mental health space, telehealth is wonderful. Telehealth is great. Telehealth saved many people's practices. People hate telehealth. I hate telehealth. I'm with Robin on the telehealth thing. We were one of the first clinics at Connecticut Children's, our obesity program, to open back up to in-person visits about 2.5 months into the pandemic, because most of the families we served couldn't access Wi-Fi to do telehealth visits. Or I was doing visits with them in church parking lots or at Burger King's connected to their Wi-Fi and things like that. So I think to Jennifer's point, what we knew going into the pandemic has just blown up in scale when we think about how we you know, I think about where I took my mom to get vaccinated for COVID. I took her out to the east, to the airport that closed up. It was the big drive-through. What if my mom didn't have me to drive her there, or things like that? Then you know, where were you going to go and how are you going to get there? And it just became so clear during COVID, just these inequities we have all over the place.
Or if you don't have a driver's license or a form,
Yep.
and early on you needed to show a form of ID, you know, for vaccine.
Melissa,
even,
I would,
go ahead.
go ahead.
I was going to say, even when I was getting my booster shot, I needed to enter all my insurance information and asked a large amount of information that I don't know everybody would have wanted to submit.
Yeah. You know, at the risk of sounding a little defensive about telehealth, young adults love it. And I'll just simply say that because it's convenient, you know, and young adults don't want a lot of times to come out to my office and so, but to your question, Nicosia, you know, it may sound a little funny, but I think there's some truth to this. You know, definitely addiction went up, divorce went up, but so did, you know, the sale of puppies and the sale of bikes. And so I look at that and think, all right, you know, there's good coping skills and bad coping skills, you know, and it depends which way people turn. Because I think when we're taxed as people, we tend to turn one of those two ways, you know. And so there's a silver lining in some ways if you're a bike store owner, you know, or a breeder, you know, that certainly their business went up. But yeah, it was pretty obvious that people were definitely drinking more frequently throughout, you know, the last year and a half.
Or eating. So one of the clinics
Right.
at our hospital that got the most referrals was our obesity program. Still to this day, we have a tremendous number of referrals. But that also can date back to the early parts of the pandemic, particularly if you lived in the city of Hartford, you weren't finding fruits or vegetables or really anything of value in a grocery store during those tough times.
Yeah.
Can I ask, Melissa, can I ask you a question? And I suppose Jennifer, all of you, is that you've made the very good point that like many other areas, COVID has starkly exposed inequities. And I could be maybe being Pollyanna here, but it seems like that presents opportunities. And I didn't know if you could give us some ideas of where to apply pressure to make some of these opportunities come to fruition. I don't know how else to ask it.
You know, I think for me, you know, and I'll just take back to the city of Hartford. So in the city of Hartford, when they gave all the kids Chromebooks so that they could do learning at home, that was wonderful, unless you didn't have Wi-Fi at home. And I know that there's been a lot of talks of opening up broadband so that families could access that being sort of like a right. But I think about the lack of ability to be able to access basic needs now if you don't have something as simple as Wi-Fi anymore. You can't access telehealth. Doctors don't want to see you just on the phone. They want to be able to see you, you know, your medical appointments, things like that. I think you're right. I think much like this mental health pandemic, we know we have many things that we need to fix. And much like the racism pandemic, the health inequities pandemic, the mental health pandemic, it's a shame on us if we spend all this time talking about it and don't make any effective changes for it. And I think the more that we can highlight where we're seeing problems. So we know in the early days of telehealth, we did see a lot of our families from the inner city that were not making appointments because they couldn't convert to video visits. That's a problem that we need to figure out how to address. When we talk about who's not getting the vaccine or who's not comfortable getting the COVID vaccine, those are issues that we need to tackle, the understanding between our community and our healthcare providers, and be able to create effective solutions for that as well. So you're right. I don't think it's Pollyanna to think we have an opportunity, but I think we need to act upon it.
Yeah. I would add two things, Carol. It's a great question, by the way. The first is, you know, I think that just a recognition of the collaboration capacity that we have, and whether it's, you know, a company like my virtual practice collaborating with a college to say, we're not looking to change anything, we're looking to supplement, we're looking to help, because there's so many kids out there that need services. I just think, you know, the collaboration on so many different levels can be a huge resource for many. But in terms of pressure, I would say, you know, the pressure toward the insurance companies, someone made the point earlier, and I really think this has been a cause in some ways of a real issue within, you know, mental health providers, is that the treatment of mental health providers by insurance companies has been poor. And so many of my colleagues, and I'll put myself in this too, I've done it as well, have just, you know, gotten off of the insurance panels, and because of that. And so what that means is that when somebody comes to me and they need to be medicated, I've got to, and they say, I need to find someone on the Cigna, you know, provider list or the Anthem provider list, it becomes really, really challenging. So I think if there's a place to put some pressure, it would be a recognition, even one company to say, hey, you know, we're going to change the way in which we treat providers. So providers are actually incentivized and encouraged to be a part of our provider list, so that their members can actually get services.
Is that something that NAMI can help with? Laura, you had mentioned that you're a supporter of NAMI. You're unmuting. There we go.
Hear me now?
Yes.
NAMI is there to give you lists of different things. Usually it's county help, you know, CHR, capital region, that they'll refer people to. Which doesn't always work for a lot of loved ones, unfortunately. They're there really to give you, as someone that has a loved one with serious mental health issues, support, and having the space to talk about things in a safe environment, sort of like what you're saying the colleges are doing, or trying to do. It's so frustrating because, as all the experts have said, is that insurance companies make it very difficult. Thus, there's not enough providers that are going to see someone that's on some sort of assistance. Or even when it's my son, when he was on our insurance over 20 years ago, it was hard because there was limits. In other words, when he was hospitalized, after 3 weeks, he had to leave whether he needed to or not. So we had a week available for the remainder of the calendar year. So something has to change with the whole mental health system and how our society looks upon mental health. It's very frustrating.
And I think one of the other things that I think is a missed opportunity too, and I think we've talked bits and pieces about this, but if you've never had to navigate the mental health system, bless your soul, because it is not an easy system to navigate. And particularly for our Black and Brown population, our population where the stigma is still more there than for other groups. I think organizations like NAMI and other parent and that where people have been there, done that, and kind of know the inside track can be really helpful for a lot of these families, because it's not like you can just, you could try calling people randomly. Nobody's going to call you back. You're going to get long wait lists, things like that. But I think to have that like mom who's been there, done that, and can help navigate that system, because there's some tricks that unless you've had to like navigate them, that's who's going to provide you the best information for how to navigate this system and to break some of the disparities that we see.
And I just, from a prevention standpoint, I want to mention what we call the social determinants of health. And when you don't have access to safe and affordable housing in neighborhoods where you can enjoy being outdoors and playing safely, and you don't have opportunity for a living wage, not a minimum wage, but a living wage, when you live in a neighborhood where you don't have a grocery store, these things all contribute to poorer health, whether that be physical health or mental health. And so I think we need to both simultaneously fix how we improve access to care, but these communities know what they need to be healthier and to live their healthiest lives. We know this. It's having the political will to pull back the carpet and look at the policies that have continued to create these conditions and these environments and these neighborhoods. And until we're willing to do that, we really won't prevent anything. We're going to just keep putting our finger in a dike.
Remember that the city of Hartford has no grocery store in their premise.
Exactly.
But they have liquor stores.
And big billboards.
All over the place.
Mm-hmm.
Yeah.
And so how is it, I guess, that we're missing the mark in so many places? Because we could talk about economic disparity, we could talk about housing disparity. We've heard from Robin, and she's talking about some of her mental issues that she has, or just that she's had to deal with in her life. And then we have elderly that's not able to access the drive up. How is it that we're really missing the mark? And just it seems to be just so many places with so many people. Like, I didn't even think about the drive up part because I was able to drive up. you know, but then hearing you say it, I'm like, oh man. And so like, I didn't even think twice about it. So I know when you say we got these policies, is it people first, policy second, policy first? You know, how is it? We just really just seem to be missing the mark, you know, with just being able to assist, you know, just a lot of people in a lot of different areas. And then and you're saying exactly right. This is another demonstration, you know, of it. And then talk about grocery stores. You could talk about affordable housing. You could talk about mental health care access. You could talk about insurance. I mean, these are just major societal issues. I don't know if I kind of digressed on that, but I'm just kind of, you know, we missed the mark in so many places, and we seem, and you said we seem to be okay with it, you know, and that's the other part.
You know, if I could just comment, because I think you make a really good point. I think we live in a very reactive world, you know, and I think, I can't remember who said earlier, but we have this opportunity. You know, I guess it's partly the silver lining of what we're going through right now. We have this opportunity to say, hey, do we want to continue to do this? Do we want to just continue to put our finger in the dike and wait for there to be, you know, a worse epidemic? You know, I mean, in the last 10 years, the suicide rate for young adults has gone from 12 to 2. It's the second leading cause of death in young adults. And this is the next generation of people that are going to be running our world. You know, so at some point, you know, I don't know if we have to get angry enough. I don't know what it is, Nkosi, but I feel like where change happens, you know, maybe it's a community, maybe it's one town, maybe it's one area where they say, I'm sick of this. We're going to do this differently. We're going to bring some more providers in, we'll bring some more access, and we're going to do it differently to see the ripple effect, because we are really being reactive right now. We are definitely being much more reactive than proactive.
The suicide's the second leading cause of death, starting with kids at age 10, which is really frightening when you think about that.
Terrifying.
One of the things that we kind of always say at the Children's Hospital is that, you know, and I think this has to be the case, because when you talk about people or policies, I think it always goes back to money, right? And so for us at the Children's Hospital, you know, behavioral health, mental health is how our hospital lives its mission. You can't live a mission of a children's hospital if you don't take care of the emotional health of a child. But I don't know that that extends down to cities like and towns and municipalities and things like that. I mean, the level and where do you start? And I do want to acknowledge that somebody asked in the chat about young kids and the impact of this on the mental health of young kids. There is no one that's being not impacted. And where do you even start? Like you, Cody, you listed this whole thing that's so overwhelming when you think about it. Like, where do you even start to really make an impact? Because you can't make a true impact in mental health if someone doesn't have housing. Think about the social determinants of health, or ACEs, or whatever kind of term you want to use. I can fix your depression, but I can't do that if you're going to go home to a non-home or an unsafe home, or you've had to walk 3 miles to get to this appointment, or things like that. It's like, where do you even start, like with the basic needs? But then how do we help your basic needs if you have your kind of your mental health challenges or substance abuse issues as well? And then how do you put that all together in a way that people will invest in, recognizing that none of this is sexy to anybody. Like none of it is like what people want to put on their billboards or anything like that. And I think that gets to be challenging as well.
I think too, I mean, working at a college that, you know, feels very much like a microcosm of kind of our society, you know, just in this sort of like residential like setting is, I think you're right, Melissa, like so much of it comes down to money. And as like a tuition driven institution, you know, we're hearing more and more like, what does CAPS need? And like, what can we do to provide like more for the mental health and wellness of our community? But when we come up with ideas, you know, all of a sudden there's no money there. But, you know, we just got a $33 million STEM building, you know, for the physical therapy program and for the engineering program. And it's like, okay, so what has to happen? You know, like Mark was saying, like the reactivity, I mean, there have been so many suicides at college campuses in Connecticut in the last couple of months. And we've been talking a lot with our administrators is, you know, it's not a matter of when this happens at UHeart. I mean, if, it's when. And so what do we have to do to get you to invest in the same way, like holistically, from beginning to end, from orientation, the first day that a freshman steps foot on our campus to the day that they graduate and leave? like that's built into their experience and their learning, that those resources are just as plentiful and prioritized as, but I think, nobody wants to put their name on a counseling center. Nobody wants to buy us a new wellness center. Nobody wants money for like a new psychologist because, so I think, I hope this is an opportunity, and I hope that things don't really have to get worse either on our campus or in our larger community before people realize like this is just as important. It can't be separated, and it does need to be fully invested in.
And so I guess what they're being so overwhelming at times, and I guess it just comes back to just one person at a time, one individual at a time. But sometimes when you look at it, like in the the macro view, it can be a lot. And then sometimes I'm one person, that can only do, so much. So we do one thing, at a time. And so I guess that's where we hope where we all can be at that place where we can say within ourselves that we're trying our best, one person, one moment, at a time. But yeah, it's a lot, and it is, very very overwhelming. And so, and I guess I will also ask the question, because we know you were talking about a little bit that you're being pulled in so many different directions right now. So I would just ask the question, perhaps hopefully for your benefit, what is it that you find yourself doing, to try to regain a little bit of yourself and to, prevent yourself from being burned out so you can be effective and be there to help others? So what is it that you do?
I think Dr. Hill said it well when she talked about the resiliency that I think sometimes we just have to kind of instill. And I think part of that comes from having a good network of people that you can go to for sort of different things. And I think, at least for me personally, that has been very helpful to have, different people to go to for different things. And then, gosh, honest, I think Jennifer had said this too, what you find to be helpful or what you feel comfortable doing in social situations. So we have tried to do all sorts of social situations that we all feel comfortable with, but that maybe help get out some of that inner stress. And if you've never done axe throwing, may I suggest flinging a few axes at walls is amazing for the upper body, as well as just for getting out that inner, like, wing, take that, insurance company. So.
Yeah, I think good self-care, and Nkosi, you mentioned this earlier, like what do we have access to, as human beings? When I'm talking to college students, most of them, they're on campuses. So they can, if they're physically able to, take a walk around campus, put their earbuds in, listen to some music, and recognize, probably the most important thing is recognize there's some importance to that. Are they getting good sleep? Are they getting a little exercise? Are they eating decent food? So many kids, when I bring that up to them, they're kind of shocked, like, oh, that has an impact on how I feel, and then I say to them, yeah, maybe the largest impact on how you feel. So I would say, I personally do it, but I would say also that, kids as well as adults, if we can just take better care of ourselves and realize we got to slow down a little bit, and make sure we're getting good rest, make sure we're getting, good self-care in so that we can be good helpers, throughout the day.
I love, the idea with the simplicity of that mark too, right? I mean, and again, it's like, it doesn't have to be any kind of like, super clinical, medical, like, psychologically kind of like based thing. Like sometimes just the simple basic things. But I think something that I've talked a lot more about on our campus in the last year and a half than I ever have before is this idea of practicing gratitude, even in a time when things feel very bleak and uncertain and unpredictable and negative, and some people have really, suffered so much during the pandemic. But I think, again, like that is something that we have control over is, what can you be grateful for, whether it's your health today, whether it's the relationships that you do have, whether it's the opportunity to slow down. And so, I mean, I think, I've been talking about this too, is like, everyone has been impacted by the pandemic for sure. That's undeniable, but not everyone has been traumatized by the pandemic. And in fact, like some of the students I work with are so thrilled, especially with social anxiety or agoraphobia or panic disorder. Like they love being in their room. They're so glad everything can be virtual. They don't have to come to my office. They don't have to leave. Like they can take all of their meals back to their room. And again, like as therapists, we might argue like, that's not going to work for like a long time. That's not necessarily going to help with your social anxiety in the long term. But I think even for people more introverted, my husband is an example. Like he has been so much happier being able to work from home than having to go into the office. And I think as much as like you, Melissa, like I have begrudgingly switched to telehealth in a lot of ways, and there are things I really hate about it. I also really stopped to reflect over the last year and a half when the college campus was closed, but we were working entirely from home, was what are some of the benefits that this does bring me? Since I can't change it, like I get to pop downstairs and have lunch with my 3-year-olds. And that wouldn't happen if I was in the office 5 days a week. I was able to exercise more in my neighborhood during the day, or, I think, to encourage our students, our patients, our families, our friends to really stop and say like, there's a lot that sucks right now. And we're not trying to like deny that or sugarcoat that or avoid it, but really we also, maybe each of us have some things, however small, to be grateful for and to hold on to and prioritize where we can.
Definitely.
Right. We gotta count our blessings, right? Count our blessings. That's what it is.
I think one thing I would add, and I think it's wonderful. I will take all of our professionals' ideas and try and implement them. But one of the things that I'm really trying to do is readjust the expectations that I have of myself, and also help my staff understand that they can readjust the expectations that they place on themselves as well. And I think all of us have the opportunity to just kind of step back, even students in schools. I mean, who sets these standards, and why can't these standards be adjusted, recognizing the challenges that our kids have experienced in the last 2 years? So just taking time to readjust and be honest about what we're expecting of ourselves.
Right. That sounds good. Yeah. Our own, in the midst of all this, trying to be well, ourselves is, been, quite a challenge. But like you said, Dr. Hill, things you could be thankful for, so thankful that, last summer I was home with my sons and we could go out and exercise every day. Because I was thinking on the flip side of like, there was no one home with them. Like what literally would they be doing? Like literally for like 9 hours, of the day, not going anywhere, and so I was very thankful to be able to be home and just to be able to go out, take walks, what have you, and just to be able to get out the house for a little while, and just that we could do it and, do it in a safe, safe manner. So yeah, I definitely, get what you're saying, with all of that. So yeah, well, we thank you again for being with us. Right, we see that, Lori. Yep, thanks to all the panel members for this informative session. Yes, and that's how it is. And on behalf of the Spirit Council, we do, say thank you. Your expertise, it's appreciative. Just the advice, the atmosphere that you are able to provide us with, so be able to ask questions that you answer, and again, just that it's professional advice as well. And so we thank you that you take the time out of your schedules to be here with us this evening. And so we're trying to navigate this the best that we can, trying to stay healthy mentally, physically. It is so overwhelming. It is. And I don't think we really get to say how overwhelming, it's true. I'm speaking for myself. I don't get to say how overwhelming it is. I'll speak for myself and not say we. I don't get to say it, but, sometimes you hear from someone else and you hear what they're going through, and it allows you to put some things in perspective, as well as, with some of the issues other folks are dealing with, you know, during this time. And so, yeah, and so we just thank you, you know, again, for taking the time out of your busy schedules, you know, to be here with us this evening. And so again, you know, on behalf of the Spirit Council, on behalf of the town of Simsbury, thank you to the Simsbury, you know, Public Library, and just to all of our guests who took the time out. I know probably our one regret is that, you know, what was shared this evening, we wish there was like hundreds, you know, that were able to hear it, you know, and unfortunately we're not in that, you know, place to do that, but it was, you know, that much quality. But again, we just say, you know, thank you. We wish you well in all of your, you know, personal endeavors, and just, you know, that you can remain strengthened and encouraged, you know, in all that you're dealing with as you're helping, you know, other people, you know, try to navigate through all their issues in the midst of a pandemic, in the midst of economic uncertainty, in the midst of educational uncertainty, in the midst of family uncertainty, in the midst of everything, that all the uncertainty that people are facing, that, you know, that you're still able to provide, you know, excellent services for them and care for their needs. So thank you all.